In today's Health and Wellness Report, updated COVID vaccines are on the way to pharmacies and doctors' offices.
The FDA just approved these vaccines yesterday, and as the virus is still surging this summer, Health and Wellness reporter Lauren Petty is joining us with details about the vaccine and the timeline of when people can get them. Lauren?
Alex, with this surge underway right now as school is starting back up, the FDA acted earlier this year. Last year, it wasn't until mid-September when the agency approved updated shots. The thought process now is that the COVID vaccine is more like the flu vaccine, updated yearly to protect against the newest strains. So that's why late yesterday, the FDA approved updated shots from both Pfizer and Moderna. The vials are expected to be available within days. These updated vaccines, they target the KP.2 strain, which was prevalent back in May, but the CDC says other strains are now dominant. Still, Pfizer and Moderna both say the vaccines can produce stronger immune responses against the subvariants that are circulating now. So, who should get these shots? Well, the CDC recommends everyone 6 months of age and older. We did speak to an infectious disease doctor at Rush. She says people who are especially vulnerable should get these updated shots as soon as they can.
I think if you are immunocompromised and in one of those high-risk groups, then it does make sense to get vaccinated sooner than later because we are in the middle of a surge. The problem is, come 6 months later, will your immunity be waning? Now, it does appear that for immunocompromised people, they will be able to get additional doses.
Now, the CDC says it is okay to get the flu vaccine at the same time as the COVID vaccine, but Dr. Shah says it's also okay to just wait a few more weeks to get your flu shot, so that way you're protected for the entirety of flu season. So when will these updated shots be available? A lot of people asking that. We did check with some of the major pharmacies. Walgreens says appointments will be available starting 2 weeks from today. That is on September 6th. CVS website says they are removing stock of the old COVID vaccines to make room for new ones and to be sure to check back for updates. You can also check, of course, with your primary care doctor or your pediatrician as well. Most insurance companies, they have been covering the cost of COVID vaccines in the past, and they are expected to continue to do so. And one final point, pregnant women. Pregnant women are encouraged to get the newest updated shots to protect themselves and their baby.
Okay, good to know. I know it's out there, but sometimes you don't see it or you're wondering. So thank you for bringing all that information to us,
Breaking it
Lauren.
down.
Appreciate it.